Hello, we're back with ExpertCast, the podcast dedicated to innovation in healthcare. I'm Gustavo Meirelles, and in this second part, we'll explore how artificial intelligence and new technologies in collaboration or driving a new era in breast cancer diagnosis. I'm delighted to continue our conversation with Professor Hilde Bosmans from KU Leuven, the Catholic University of Leuven in Belgium. Professor Hilde, welcome back to ExpertCast. So we're going to start here with a question again related to the evolution in breast imaging technology and new techniques. So, in your opinion, how do collaborations among researchers, clinicians, and imaging vendors help drive continuous quality improvement for breast imaging uh, as a whole?
Oh, wow. Thank you for this question. Your question has different pieces, and it's exactly, I would call these the pieces of a puzzle that has to be brought together to make the whole thing okay. I mean, without a good device, no good image. Without AI, not the advantages of AI. Without a good patient positioning, the image will be blurred. So, no, all the pieces, in fact, have to be put together in a collaboration, of course, because just as islands, it will just not work. There has to be this common striving towards an improvement, I think. And okay, all the specialists will have to work on their domain where they are the experts, but then ultimately have to bring all these new findings together into a new setting, not just a new equipment, but a new stream of for the patient to go through and improve ultimately the results of the screening program.
Very good. And well, besides working in collaboration, AI has been gaining ground in breast imaging. Well, as in anything in the world right now, but in breast imaging, especially
Mhm.
in screening for breast cancer, AI is more and more being used. So, in your opinion, what are the most promising applications of AI in this field today?
Thank you also for this question. There are many promising applications of AI, but I would like to pick maybe three ones that we have been studying here as well. The first thing is that in breast imaging today, we acquire digital images, so an AI algorithm can work on that image. And a first algorithm, AI algorithm that works quite well, is an algorithm that searches for small lesions or large lesions, but preferably the small lesions in the image. The small lesions are usually more difficult to find than the larger lesions, not always, but usually. And okay, AI can help there. In fact, compared to the other domains in radiology, AI is very well developed for breast cancer screening. I think that is because in breast cancer screening, we know which performance we expect. Like, for instance, we have to find 6 per thousand cancers in the population, and we can immediately check with numbers how many more AI will give us. And also the data are acquired in a very standardized way. If we are still with 2D imaging, like in our country, it's two breasts, two views, and the previous round would be the same. So this is very standardized. There are not too many centers where all of a sudden they would use 6 views or something. So that's the ideal input for the development and the application of AI, because we can control the benefits. So computer-aided detection is for sure a big one. Another one is also linked to computer-aided detection, or how it's used could be for what we call as a safety net, which is after the radiologists have read the images, then the AI goes over and finds maybe smaller lesions. Another possibility is in triage, and we mean with this that the AI goes over all the images to be read and already tells which one will probably be normal and which one will probably be, well, not abnormal, will not necessarily have a lesion, but are more difficult and where it's not trivial to say this is normal. So this type of triage where maybe the easy images are not read anymore by a human or read only once, versus the differentiation into a bunch of images where it was a little bit more difficult and at least two readers have to have a look there, maybe a third reader helping with or without the help of AI. And then there is a third field, which is breast cancer risk prediction. And this is an algorithm that you apply after the images have been read and the images are negative. No cancer has been found in these images, and on these images you apply the breast cancer risk predictor. And with this algorithm, it if it really works very well, and we are testing, several institutions are testing this, it would be possible to maybe change the screening into more frequent screening for the women with somewhat increased risk, or less frequent screening for the women where really it's obvious from the image and from the AI algorithm that the risk is very limited. So there we have the possibility to redistribute the budget of screening a little bit by seeing some women more frequently or with other techniques and other women less frequently, because really there is it's not needed to see that woman because more frequently, because the risk is really low.
I also foresee many innovation coming together with AI, and where it's completely changing the world, not only for breast cancer diagnosis and screening, not only for healthcare, but for the full society. And but at the same time, many people still see artificial intelligence as a threat, and some radiologists do feel afraid that they could be replaced by AI, while others see AI as an ally. So, again, in your opinion, how do you envision the ideal collaboration between men and machines? I mean, radiologists and AI tools in breast cancer screening.
Yeah, that's also a very good question. It's not an easy one. In my opinion, a radiologist can probably improve his performance, her performance, when helped with the right AI tool. Not with all AI tools, but with the right one. And it's a bit difficult to know what is the right AI tool for a radiologist, and that may depend at which level the radiologist is already. If he's already an expert in breast imaging since 25 years, he or she may be helped with another type of program than a starter. And it depends maybe also on the population for which you work. I think every AI algorithm would have to be tested first in the images given to the specific radiologist. So with a good AI tool, I think a radiologist can outperform. I'm not sure that we, as a say potential patient, are waiting for an AI algorithm on its own. The day that I may have cancer or there's something suspicious in the mammogram, I would be helpful but grateful that the AI helps, but I would like the doctor to speak to me and explain what this is going to mean for me and double check what AI has so-called learned, especially in these new AI algorithms that start to learn from combining a lot of data, less straightforward. I mean, in the first AI algorithms have probably been trained more with like well-known lesions indicated by radiologists to be meaningful with all the biopsy reports and all together to improve it. If now more general AI algorithms find even more, are trained with more cases that are much more difficult to control, I think we would have to control that the quality of that AI algorithm even more. And ultimately, I think the solution is in combining the AI, the brand new AI, with the input of the radiologist. But it will surely be better than the radiologist on his own in the evening or the early morning in good conditions or near the end of a working day. There may be several factors that probably, not all, determine performance and where the AI can, yeah, help to keep the performance at the high level, I think. So the safety net, I do believe in the safety net idea.
Yeah, thank you so much for those wonderful insights, including the safety net. And I think this is the right way to go with a collaboration between radiologists and AI for breast cancer detection. And our final question here, looking ahead, what do you believe in the next 10 years will bring in terms of breast imaging innovation? So, how do you foresee the future, and how can this evolution improve patient care and outcomes for breast cancer imaging?
Yeah, that's also, well, it's always difficult to look into the future, of course. What we see these days in AI coming up is a multimodal AI, where, for instance, images of a breast X ray exam are combined with other types of images or data, genetic data, or, well, yeah, from other modalities or the combination of a mammogram and an MRI to find even more or to learn several aspects of the breast and then combine it into a finding or at least a conclusion. This may, well, these AI algorithms will surely combine more data than a radiologist can do because it's difficult to think of to look at five modalities at the same time, while maybe an AI algorithm can cover this. So I would expect that there is going to be some evolution in, yeah, detection, but not only detection, also prediction of what outcome could be in combination with this or this therapy. So technically, yes, I do see yeah, a bright future. I'm not sure whether we should then boost also the AI for the more psychological aspects, or you see sometimes podcasts in which people say that they speak to an AI, an artificial person, to get some input on, yeah, how to get through a difficult period of recovery and so on. I'm not sure I'm this type of person. Again, I would probably still prefer to talk to my doctor or to a nurse to get these inputs and feel better after surgery, after treatment. But who knows, that maybe AI can have their role also to fully recover. I don't know. That will certainly help by combining. So my point was combining a lot of data, not just the mammogram.
Well, we have a wonderful future here for the next few years. It's always very hard to predict the future, but we try to do it. And thanks again for um, your recommendations and your insights. So we have a tradition here at the ExpertCast. We call it in Portuguese papo rápido. In English, we're going to translate it as the quick chat. And the first question relates to a recommendation of a book, a trip, an event, or a TV series. So, what would you like to give as a recommendation here for our listeners?
Okay, I'll try to make it a quick chat. Um, I would say, well, I have a suggestion for you to start summer, European summer, in a nice way with a conference in Greece. End of June, there is the International Workshop on Breast Imaging that takes place in Thessaloniki in Greece, where we bring all the experts on breast imaging together because IWPI stands for International Breast workshop on breast imaging. It is a nice setting. It is all collaborators that have been mentioned before together in a setting in a conference discussing about the future, exactly what we've been discussing here. So this will be wonderful to meet with you.
Well, that's a very good hint here. So for everyone interested in knowing a little bit more about that topic and also going visiting Greece, so that's a very good recommendation. So the second question relates to your own health. So what do you do, Professor, to take care of your health?
Well, in terms of breast cancer, I do attend the screening, and I was happy enough to be able to take part also in trials where they check for the higher risk patients. So that's just for breast cancer. Apart from this, I'm not sure. I am very dedicated to having the best lifestyle, apart from trying, of course, to go outside and walk every day a bit, and then in the weekend enjoy my garden and do some biological approach to gardening and vegetable culturing. But I'm not going further than this. Just, yeah, type of maybe simple life,
That's great.
simple things. Yeah.
And well, again, related to breast cancer diagnosis, screening. So who would you like to interview on a podcast on that topic?
Okay. I often like in podcasts like testimonials from people who really know something and want to share something with me or with all people listening to the podcast. So I would probably just interview my own mom, who, due to well early well screening, discovered that she had breast cancer, and she was treated several years ago. She survived it happily. We are all happy, and she's one of the most positive people for the screening, and like checking all news, and she would probably be very happy to address all of you and encourage people to go to screening. And but it's better to hear it from a person with this sad experience of having had the cancer.
I would love to hear that podcast between,
I can arrange
the
it.
mom and daughter about
Yeah,
such
why
an
not?
important topic. And our last question today, Professor, which innovation do you find the most transformative?
Yeah, there's probably the doubt between two. First, the 3D imaging of the breast that becomes available with tomosynthesis, which is pseudo 3D, and breast CT, which is then the true 3D, where happily no longer all lesions are superposed on each other, but are sliced. So, well, we see them as the breast as several slices using just mammography techniques. And breast CT is basically also an X-ray device rotating around the breast and generating the 3D. Next to this, of course, there is the AI that does so much more with an image. The combination probably of tomosynthesis and AI is probably going to be a winner. At this moment, introducing tomosynthesis, so this pseudo 3D technique in the screening, is just for our radiologist not feasible, because then they get of the breast of the woman one or two 3D stacks, and these images are read in a very short time, and this is extremely exhausting for radiologists. But if there would be an AI going through a tomosynthesis stack, pinpointing where are all the suspicious lesions and an easy way to go through this stack, maybe that could bring tomosynthesis in the screening. And then this combination of 3D acquisition with AI to find the lesions, that's probably going to be a winner. We can then further combine it with algorithms that predict the risk, and then indeed tell which patient, which woman should get this combined 3D AI or just a 2D AI or just no screening at all because the risk is basically zero. So this is, well, it's not a quick chat answer, but there's a lot of work ahead to realize such a scenario.
Yeah, it's not a quick chat answer, but a great answer. Thanks again for your answers, not only for the two parts of our podcast, but also for the quick chat. So again, I'd love to hear that podcast between mom and daughter about such an important topic. And again, Professor Hilde, thank you very much for joining us and for your thoughtful insights. It's very clear for me that breast cancer diagnosis is entering a new era, combining human expertise, cutting edge imaging as the main, the different technologies you have cited here today, and also the power of artificial intelligence to truly see earlier and care better. So thank you again for taking part at ExpertCast.
Thank you. It was a pleasure.
And for you, if you'd like to keep following this conversation on healthcare innovation, join the healthcare innovation community at inovaçãosaude.com. You're going to find our groups, which are free to take part in. And you're also going to be part of a community with more than 13,000 people. ExpertCast is a project supported by Agfa Radiology Solutions and produced by SoPods. If you enjoyed this episode, follow our podcast, rate it 5 stars, and share it on your social media. Thank you again, and see you in the next episode.